Greetings, my name is Jae'dah Nave.
Greetings, I am Mykyla Hooper.
Greetings, I am Kimberly.
Greetings, I am Tytianna Hankerson.
Greetings, I'm Valerie, and this is our presentation on physical therapy and rehabilitation centers.
Okay, so I'll be giving a little bit of background about the history of physical therapy in general. In 1800, gymnastics started being used in America to treat injuries and pain. In the year 1900, physical therapy starts to develop with aides using equipment to heal soldiers. With the polio epidemic in 1916 and the start of World War I, physical therapy treatment advanced quickly. 1922 marks the American Women's Physical Therapeutics Association, changed its name to American Physiotherapy Association. In 1936, students only needed 2 years of school to practice physical therapy. Physiotherapists changed titles to physical therapists in 1940 to separate themselves from physicians. In the 1960s, the prerequisites were raised to a 4-year baccalaureate degree, and it expanded once more in 1990 as all programs moved towards a master's degree. Florida A&M School of Allied Health Sciences, more specifically the physical therapy program, was established in 1981 and became the third program within the State University System of Florida. In 1982, the first group of students were admitted to the baccalaureate program. In August 2001, the last batch of graduates were given their degrees. All doctoral candidates in physical therapy must be bachelor degree holders. In 2020, the Doctor of Physical Therapy program graduated 100% of its students, also with an 88% first-time success rate on the National Physical Therapy Licensure Examination.
So, what is the purpose of this profession class? With the profession of physical therapy, as you can see, we have the professionals work to improve their range of motion. And they relieve this patient's range of motion. They relieve pain and patience by increasing muscle skills, hand-eye coordination. And as you can see a little later on inside the slides, we also have this practice through exercises, massages, electrotherapy, and hot and cold treatments. How do they practice this? So we have two different types of care. We have our inpatient care and we also have our outpatient care. With inpatient care, that's more so what you'll see inside of hospital settings, maybe 24-hour watch, and different things of that nature. And outpatient care is when we release the patient outside of the hospital and continuously still do the work such as that. Within the scope of the educational requirements, the main thing that you want is a bachelor's degree, and with the MU's program, we usually do the bachelor's degree in physical therapy, pre-physical therapy, and then we progress and matriculate to our Doctor of Physical Therapy program. You can also, afterwards, receiving your Doctor of Physical Therapy, you have to take the NPTE, which is the National Physical Therapy Examination. Afterwards, each state has their own different requirements once you do the licensure, but just make sure you check within your local state's requirements, because after you pass the licensure, some require extra background checks and different things past that point.
So some of the main benefits of physical therapy is reducing pain, increasing the mobility, and manage age-related health issues. It helps restore your balance, and it's also an alternative to surgery because it's less complications. As of 2023, there's about 500,000 providers employed in physical therapy in the U.S. and about 38,000 physical therapy locations. The types of physical therapy exercise are range of motion exercise, balance training, strength training, ambulation exercise, cardiorespiratory exercise, and vertigo and dizziness.
Some clubs and organizations and internship opportunities at FAMU involve the HSPPTA, which is the Health Science Free Physical Therapy Association for undergraduate students. It is an organization committed to meeting the needs of patients in clinics and also representing minorities within the physical therapy profession. Along with that is the GPTA, which is the Graduate Physical Therapy Association, which is an association dedicated to working on developing strong relationships between patients and practitioners with an effort in manning underserved areas. There was also an internship program at the Kinetics Physical Therapy Center in Gainesville. It was actually available this past semester from May 11th to December 31st. They help take students into real life situations by learning new techniques and adapting to a professional setting.
The impact and contributions of physical therapy. So physical therapy has often been used as an alternative to surgery and allows more of the Asian population to stay active longer. PT has even become a solution to the ongoing opioid crisis. Not being put on drugs, doing physical therapy leads to, you're not being put on to opioids, obviously. PT has also contributed to reducing healthcare costs and allowing shorter recovery times with patients.
One of the main issues that physical therapists see is patient retention, which is the failure to fully commit to the entire duration of your physical therapy. 7 out of 10 patients tend to drop out of physical therapy because they come in strong, but do not always fully finish all the way to the end. And since we are in Florida, the main contribution to physical therapy are retirement and elderly people, and they tend to complain about the amount of intake forms, but the solution is that now most of those intake forms are online and they're available before your first appointment at physical therapy.
Another issue in the physical therapy field is with COVID-19. During COVID-19, we had staffing shortages, restrictions for therapy. People couldn't come in to get the treatment that they needed, so it led to telehealth. And then there were barriers with discharge. Telehealth is defined as the provision of healthcare remotely by means of telecommunication technology. Telehealth has become so widespread in the world that PTs have had to adapt to it. The director is Tracy A. Thomas, PT, DPT, PhD holder. She received her doctorates in philosophy from FAMU and taught for 6 years at Alabama State University.
And as you can also see, we have 2 fun facts today about Dr. Tracy Thomas. First fun fact, Dr. Thomas is the only African American woman to have a bachelor's in physical therapy and a dual PhD of pharmaceutical sciences with a concentration of cardiovascular pharmacology and toxicology too. On March 1st, Dr. Thomas was awarded a Trailblazer Award by the Oasis Center for Women and Girls. And next, that concludes our slides. These are our sources, and we have a mini Kahoot game for you guys that you can play as well. Yeah.
We could do like 2 slides.
So this is our game, and you guys can go ahead and log in with the game pin and test your knowledge on our presentation. Thank you very much.
Thank you.
Thank
guys.
you.
Yeah.